Hi, this is Brian Kim. I want to share with you two cases where I'm going to show how I'm able to mobilize a stuck lens in the subincisional space. So sometimes you get lenses that are stuck and the natural tendency is to just push on the lens and continue to kind of torque it so you can turn that lens in front of you. Unfortunately, when you do that, you can rip the zonules and cause damage to the zonules. And I've always wondered when I see patients come in with dislocated lenses and the whole bag is also dislocated, is it because the original surgeon just jammed on the zonules and put so much stress on the zonules that there's a late presentation of dislocation? I don't know. I do know that right now, if you're going to be doing cataract surgery, I advise you not to do that, and instead you can do a couple of things. You've seen a previous video where I rehydrodissect to kind of lift that area up, and you just push and separate fluid in that space, but you can also reviscodissect in that area and just kind of use the viscoelastic to push the lens out from the capsular bag. But you're going to see here, I'm going to leverage the instruments in my hand. I'm going to use my chopper to get underneath that subincisional space, getting within the capsular bag around the rexus edge and just twirling the chopper, and it just pops that lens piece up. It's really a beautiful and elegant way, and I don't know why I never really did it this way before, but whenever you have a stuck lens, again, even if you have great hydrodissection, sometimes you'll see that the bag just is very, very loose and the zonules are loose and it doesn't want to come. This is a way to overcome this problem. So you can see here, I get a nice hydrodissection wave, decompress here, and I'm going to start to push BSS and try to release the anterior capsule from the lens on the left side and then the right side. But as you can see here, as I'm trying to spin the lens doesn't really want to spin. I try to be really gentle here. I don't like to just manhandle the zonules. I'm trying to be very gentle here. So you can see, just very gently, just trying to tease it very gently here. You can see I'm just very gently teasing it. And it is starting to spin. But you can see it's taking quite a bit of force to do that. So I just go ahead and stop. We're going to go ahead and proceed with the cataract surgery, irrigating the surface of the eye, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, placing the chopper under the rexus edge contra-incisionally, tilting the phaco tip vertically subincisionally, bringing the instruments together and fracturing the lens in half. That is double chop, placing the chopper around the right heminucleus, pulling it centrally toward the phaco tip, and that is cross chop. Doing the same maneuver around that first quadrant and chopping that first quadrant in half. You can see the lens is rather sticky and it doesn't really want to come out of the capsular bag, despite using vacuum as well. So I'm using the chopper to kind of encourage and pop the lens piece up out of the bag. You can see the bag is also rather flimsy. You can see that there's some zonular laxity there. I'm able to separate that second quadrant from the rest of the lens, getting around the lens with the chopper, pulling it centered toward the phaco tip and fracturing that lens piece in half, and then using some vacuum to mobilize it, and then crushing it in smaller pieces, and then emulsifying the lens piece. But you can see here that subincisional second heminucleus is not turning. So this is what I'm going to do. I'll place the chopper around the capsular rexus edge, twirl the chopper tip, pulling it centrally, and look, it just pops the lens up. Now you can see here, that's between the epi and endonuclear interface. And so I didn't even get all the way to the capsule, so there's no direct zonular capsular bag stress. So once I lift it up, I'm able to bring the instruments together around it, crush it, and sandwich the lens piece. And then I'm sandwiching that third quadrant into smaller pieces, and then emulsifying the lens piece. And so that's the move. It's such a cool move. Grabbing that fourth quadrant with some vacuum and then getting around it with a chopper, crushing it into smaller pieces, and then emulsifying the lens pieces. So again, this is a fairly loose bag. I was able to fracture that first heminucleus in standard fashion, but that second heminucleus stuck underneath me. Again, I could have rehydrodissected, but I didn't. Rather, I just turned that chopper around underneath the rexus edge, twirled it, and popped the lens right back up. So you can see I finished the lens removal, and then this is the end of the case. This was a PanOptix case. So of course, this patient's paying a lot of money. You don't want to be ripping his zonules at the same time, right? This is how you can easily pop lens pieces up out of the bag without causing any zonular stress. And now this is the second case. You can see I've already started the case and now again straight to hydrodissection, but look what happened. Did you see that bubble? I'm going to show it to you again in half speed. I place the chopper under the rexus edge contra-incisionally, point the tip down. I start to get a wave. Look what happens. That air bubble just shoots out, and then it suddenly causes the hydrodissection wave to freeze, and that's where the wave is. And so I think that disruption with the air bubble caused that dissection wave not to propagate posterior, and then instead the wave just turned and made a U-turn and started going upward. So it caused hydrodissection failure. And so I go ahead and sweep under the rexus edge on the left side as well as the right side. And I'm going to go ahead and try to very carefully hydrodissect as I go on the edges as well. But in my mind, I remember seeing that wave just stopping when I saw that bubble. I'm turning the lens. You can see it's turning not too bad. And I'm just trying to be very mindful as I'm turning the lens, again, being ginger with it as well. So irrigate the surface of the eye. You can see some bubbles on the corneal endothelium, and I'm just going to leave those there. And this is just going to simply illustrate how I'm able to do disassembly techniques without removing that viscoelastic that's coating the cornea. So removing the surface epinuclear material, placing the chopper under the rexus edge contra-incisionally, pointing the phaco tip vertically subincisionally, fracturing the lens in half, that's double chop, placing the chopper around the right heminucleus, pulling it center toward the phaco tip, and that is cross chop. So the lens is now effectively chopped in 3 pieces, lifting that first quadrant up with some vacuum, crushing it between the instruments, and then emulsifying the lens piece, turning that second quadrant in front of me, lifting it up with some vacuum, and then crushing it between the instruments, and then emulsifying the lens piece. So you can see there's no disruption of the bubbles, which means there's no fluid flow and no removal of the viscoelastic that's coating the corneal endothelium. So I'm able to turn that second heminucleus in front of me, kind of, and I'm able to fracture it in half. And then that right side piece, which is, I'll call the third quadrant, I was able to fracture it in half, and then using some vacuum to grab it, and then crushing it between the instruments, and then emulsifying those lens pieces. But I'm going to show you shortly that fourth quadrant, which is again underneath the chopper, is not going to want to move. But rather than trying to twirl it, you can see what I'm doing. I'm hooking the peripheral lens, getting underneath the rexus edge, twirling the chopper, and then teasing it up out of the bag with the chopper and the phaco tip together. And then I grab it with some vacuum. I'm able to pull it up, and then crushing it between the instruments, and then emulsifying the lens piece. So again, this is, instead of a second heminucleus, it was the fourth quadrant, again, under the chopper. Again, I could try to go after with some vacuum with the phaco tip. I could try to rehydrodissect or viscodissect, but instead I just use a chopper to get underneath the rexus edge, get deeper into the peripheral bag, twirl it, and as I twirl, I'm able to pop the lens up. And that is a benefit of having that longer and blunt-tipped right-angle chopper, which again is called the Kim double chopper. It's what I designed with Katina, and has worked really, really well for me in these cases. So now you can see there's stuck epinuclear material. So look what I'm going to do. I'm going to sweep that chopper under the rexus edge, getting it out to the capsular equator, and then I'm able to hook that subincisional epinuclear material. I was able to get part of it, but not all of it, and then I did it one more time, and now it's out. Not only can you hook peripheral endonuclear material, you can hook and pop out subincisional epinuclear material as well. So now I got the entire lens out. You can see that there's some remnants still left behind. Again, whenever I see a lens that doesn't want to spin, oftentimes either you have some zonulopathy, but oftentimes once you get the lens out, there's significant lens material that's still adherent to the capsular bag, again, illustrating the point that there was not enough hydrodissection of that lens material off the capsular bag. So very carefully, I'm just removing all that lens material off the capsular bag, polishing underneath the rexus edge, polishing the posterior capsule as well. And always polish the subincisional area. If you have some fine lens material there, it's usually a sign that there's deeper subincisional capsule fornix lens material that's still stuck inside. And so in order to ensure that there's no subincisional lens material, I use a cannula to pulse BSS into the subincisional capsule fornix. And as I do this, you can see there's quite a bit of stuff that's coming out. Pulsing some more. Again, I can go back with the sweep and sweep underneath the subincisional capsule fornix as well. So I filled the bag with cohesive viscoelastic, and here's the sweep. I'm going to start sweeping in the subincisional area, polishing the underside of the anterior capsule, making sure it's clean of the lens epithelial cells. Again, so far, it looks like it's a pretty clean subincisional capsular bag. Placing the single piece acrylic lens into the capsular bag, the leading edge goes into the bag, and as the lens unfolds, I switch to the INA. I go in with irrigation off, activate irrigation, disengaging the haptics off the optic, getting underneath the lens, tilting it, rotating it 90 degrees clockwise, removing all the viscoelastic from within the bag, repositing the optic back, polishing under the rexus edge in polish mode, removing all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, if you have a lens that doesn't want to spin, and you might see signs of it if there's hydrodissection and you get a hydrodissection wave, however, if the lens doesn't want to spin, for example, or in my case, you have air bubble in there and it just stops the propagation of the fluid wave. And if you push fluid, it should propagate posteriorly because it's pointed that way. But if there's air, the air bubble will cause this giant space, and therefore it can cause the fluid wave to take a U-turn and come out and then cause hydrodissection failure. And so again, if you have a stuck lens, don't jam on the zonules, don't rip the zonules, don't cause a problem. Please be very gentle with the zonules whenever you're doing cataract surgery. Again, you can re-hydrodissect, you can visco-dissect, you can do all these things, but be gentle on the capsular bag. And as you can see, you can also use a chopper to get underneath the rexus edge, pointing the tip towards the capsule fornix, rotating it, and you're able to pop the lens up very easily, very efficiently, very safely, very confidently. Again, this all boils down to being able to leverage and utilize a chopper beyond what you're currently doing with your cataract surgery technique. The chopper is an invaluable tool if you want to really expand your abilities and your versatility when you're doing lens disassembly for cataract surgery. So I hope this was helpful to you, and I thank you for your attention.